Hello, my name's Adrian. I'm a consultant plastic surgeon and I'm the director of Aurora clinics. I'm going to be talking today about the removal by excision rather than curettage of skin lesions. So curettage, which I've talked about in another video, is basically suitable for removing superficial lesions on the surface of the skin, and the lesions are really scooped out and removed without a significant amount of neighbouring intact tissue, and that's suitable for lesions on the surface which are non-cancerous. So on any lesion which we think goes deeper into the skin, so that's deeper into the dermis, so this is the top layer is the epidermis, any lesion which goes deeper, we really need to take the full depth of the skin away to ensure that we've got adequate removal of the lesion. So in that case, what we normally do is we would draw around the lesion and normally leave a 2 mm margin of a cuff of normal tissue around the lesion, and then remove the skin lesion going right through, removing all layers of the skin down to the fatty layer underneath. And then that is sent off for analysis, and then the histopathologist can analyse the specimen really from the top to the bottom all the way through, looking at the cells, and can also see whether there is a cuff of normal tissue all the way around, so they can cut the specimen in a way to check that whatever the lesion is being completely removed. Now, if you do remove a lesion as a circle, you can't just sew it up as a circle because you can tend to get bunching at either ends. So what we tend to do is remove that area that would bunch by a triangular excision, and that combined with the central circle involves a incision which looks a bit like an eye, with the central area in the middle. And we try and orientate that along specific lines in the body. So where your natural skin creases would be, plastic surgeons would always try and put the scars within those natural lines so that they're hidden. Normally we can get away with what we call the eye-shaped excision is called elliptical excision. Normally we can get away with that. If the lesion's a bit bigger than that, we might need to remove some tissue around some neighbouring skin, and that's what we call a flap reconstruction. So rather than just an eye excision of tissue and pulling the tissue together, if there's not sufficient give, we might need to move some more tissue around. But that's, every area and every lesion is quite specific, so it's really best to talk to your plastic surgeon about exactly how they're planning to remove and reconstruct the defect. And obviously the bigger the lesion, the more reconstruction it may need. But most skin cancers can be removed relatively simple, most under local anaesthetic, and typically the skin will be stitched with very fine stitches which are removed 5 to 7 days following surgery. Okay, the histology is the analysis of the specimen, and as Aurora clinics, we understand that most people obviously concerned about the histology, so we have a very fast-track histology scheme, and we'll be able to tell you the results of the histology within 7 days. And again, I must stress that the vast majority of skin lesions we remove are benign. So I hope that's explained some of the aspects to do with removing of skin lesions. If you have any further queries, please feel free to email us or phone us directly on 01844 214 362. So thank you very much for watching the video, and if you are worried, please feel free to contact